In the last lecture, we covered the medical treatment of diseases, which is only one part of the management of diseases, because as we all know, many diseases cannot be treated without surgery, and Ayurveda has a great heritage of surgery which the world recognizes today. And surgery in the public mind usually means operations. Operations are of course part of surgery, but surgery is much larger than operations. And I can do no better than quote a famous remark of John Hunter. In fact, I used his quote to begin this course of lectures. And John Hunter was a great surgeon who lived in the 18th century in England, regarded by many as the founder of scientific surgery. And he used to give a course of lectures in London for students, and in the course of one of the lectures he made a remark, and I quote, "And now the last part of surgery, namely operations, constitutes a reflection on the healing art. It is a tacit admission of the inadequacy of surgery. It is like an armed savage trying to get by force what a civilized man would get by stratagem." This was the unquote. This was the remark of John Hunter in the 18th century. That really shows the place of operations in the whole scheme of surgery, because surgery involves diagnosis, determination of the prognosis, use of medications, the whole lot which we have been talking about in the course of the last 10 or 11 lectures. And surgery comes in its rightful place, without which medicine cannot be complete. Now this is really what we find in the Sushruta Samhita, because many authorities regard Sushruta as the fountainhead of surgery in Ayurveda, or the Dhanvantari tradition. And Sushruta Samhita, which we have today, you will find a great part of it deals with surgery, and there is a surgical orientation to much of what he says, but there is a lot more than surgery, operations in Samhita. There is a lot about medicine, there is a lot about the theory of causation of disease, about medications, classification of diseases. We have referred to this in the course of these lectures. So Sushruta Samhita is really the whole gamut of medicine with the rightful place given for operations. Now today's lecture will be talking mostly about the general aspects of surgery without getting into the technique of operations and so on, or instruments. We will cover them as we go along. But the first part is Sushruta. Who was Sushruta? We hear so much about Sushruta, but who was he? Where did he live? What time did he live? All these are questions of interest. There are unfortunately no agreements on many of these questions, but some things are clear. Everybody seems to agree that Sushruta lived in Benares, and Benares was a great school of surgery called Dhanvantari tradition, and a king of Kashi, Kashi Raja Divodasa, he was himself a great teacher, almost given a divine status. Some even regard him as an incarnation of Dhanvantari. He was such a great physician, and Sushruta Samhita begins with Kashi Raja Divodasa and a group of students approaching him for instruction. That is how it begins. Now there Sushruta appears, because these students go to Kashi Raja and tell him, "Sir, we have come here to learn medicine from you." And then he asks them, "Yes, you are welcome, my children. What aspect of medicine do you want to learn?" And they reply, "We would like to learn Shalya, that is surgery." And then they also add, "Sir, since we will have many questions, instead of all of us asking questions and harassing you, may we ask Sushruta, the best among us, to ask questions on our behalf." And Kashi Raja Divodasa accepts. He said, "Yes, my children, you are welcome. Sushruta is welcome to ask questions." That is how it begins. So therefore, Sushruta belonged to that Dhanvantari school in Banaras, that much everybody is agreed. But there is no agreement on when he lived, and instead of quoting various authorities, A says he lived at that time, B says something else, C says something else. These are all scholars, historians, manuscriptologists and so on, who are not necessarily surgeons, who do not necessarily look at the internal evidence in Sushruta Samhita. I think it is worthwhile to look at the internal evidence of Sushruta Samhita about the procedures that he described. That gives very important clues. And one of the clues, as far as I am concerned, I am very impressed, because Sushruta describes a large number of operations, but he does not describe an operation for trephining the skull. He does not mention that at all. Now that is a very important operation, and Sushruta not mentioning it obviously means it was not being done at that time. If an operation was being done, such an important procedure, it is inconceivable that Sushruta would not mention that in his book when he mentioned so many others. But later on you find in Buddha's time, Jivaka was Buddha's surgeon, and as we saw earlier, there is extensive records in Jataka tales and legends of Buddha, etc. Jivaka doing this operation in Benares on a merchant, doing a trephining of the skull, removing 2 worms, etc. This operation is celebrated in the Buddhist literature. Now obviously, if this was done in Buddha's time and Sushruta does not mention it at all, the conclusion is inescapable that Sushruta lived prior to Buddha. I think that is a very strong evidence which has not been given sufficient importance in all these historians' discussions on Sushruta's period. That is an important consideration. And second, Panini, the great grammarian who wrote Ashtadhyayi, he is believed to have lived in the 4th century, on which there is general agreement among scholars. There are 3 quotations from Panini's Ashtadhyayi where he refers to Sushruta for illustrating his grammatic principles, not about surgery. He is said to have, there is a quotation, Sushrutena proktam saushrutam. So that what was said by Sushruta is saushrutam. That kind of quotation giving an impression that Sushruta's name was already well known in his time. That again points to this, that Sushruta lived long before the Buddha. So it is a very ancient tradition, and what we have today, Sushruta Samhita, that is not really what Sushruta wrote. What he wrote is not available to us. What we have today is a redaction of what was written originally, and the redaction was done in the 4th century AD by Nagarjuna. This much we know. So that is an important point, how ancient this Indian school of surgery is, especially dating back to Sushruta. We will be talking about the general aspects of surgery, more like an introduction to surgery when I deal with surgical treatment. Essentially I will be covering the basic surgical procedures, because when you talk about a major operation, it consists of many smaller techniques. So these techniques are used in all kinds of operations, so they may be called units of surgery, units of operative treatment. So I will be covering some of these basic surgical procedures. Then the application of these basic procedures in an operation, which consists of many such basic procedures. Then I will be saying something about the use of caustics, of cautery and bloodletting. These are not really surgical operations, but they all come within the surgeon's domain, and often in a surgical condition these are tried wherever possible, and the surgery may come only when these 3 measures fail. So a surgeon has to be thoroughly familiar with these 3 techniques. I will be saying something about them, and also the surgical options. When do you really opt for surgery? No patient comes to a doctor, physician, asking to be operated on. Everybody wants to avoid operation. So here, how would you avoid surgical operations, and when does it become inescapable? Now that surgical options, that also I will say something about it. So all these are general introductory topics in discussing surgery. Now, the discipline of surgery itself was so highly venerated. This is Shalya is the Shalya Tantra is the Ayurvedic name for surgery, and Ayurveda is divided into 8 different branches, and the first position is given for Shalya. Shalya is the first, and even Charaka Samhita, everywhere you will find in these 8 branches which are classified, the first position is always given to Shalya because of its very high prestige that is enjoyed. And the legendary teacher Kashi Raja Divodasa, in that initial discussion which I referred to, he has mentioned this to his students, which is worth reading out. Among the 8 branches of Ayurveda, Shalya is the best and oldest, and is attested by the modes of perception, inference, analogy and scriptural authority. It is the oldest because Shalya healed the wounds caused by weapons and ferocious animals in times of yore. Shalya is also the most important among the branches of Ayurveda because it produces quick results from the use of instruments, alkali and cautery, and comprehends all that other branches contain. It unbars the gate to heaven and is eternal, virtuous, worthy of high repute and generous in providing a means of living. These are the words of Kashi Raja Divodasa, who was given the status of Dhanvantari or an incarnation of Dhanvantari. That is the kind of very high reputation which Shalya enjoyed in his time, and his reference to times of yore, when he talks about it, what he is referring to is in Vedas there are several descriptions of during a war between the Asuras and the Devas, somebody losing a leg, and the Ashwini Devatas, the divine twin physicians, they are coming to fix a metallic limb. These kinds of descriptions are there. They are usually regarded as mythical, but there are references to surgery in the Vedic texts. So he is referring to that very ancient tradition. Whether it was actually done, nobody knows, but there is no question that it has a very ancient tradition even in his time. Then the surgical procedures, whenever Sushruta Samhita describes, there are very detailed indications and contraindications. This is a technical term we use in medicine. Indications for a procedure means the occasions when you would do that or you should do it, that is an indication. There is a need for doing that, and that is an occasion to do it, that is the indication. And there are occasions when you should not do it. If you do it in the wrong person, the wrong time, that can produce disastrous results, so therefore it is a contraindication. So these are technical terms used often in medicine, and these indications and contraindications for procedures, these are always listed in great detail in Sushruta Samhita. The risks of major procedures are always classified, they are given, and it is also emphasized if you are doing a high risk operation, for example an obstructed labor in a woman, and you must remember the transportation was very poor in those days. A woman might be living in a faraway place and a messenger comes saying she is having labor for the last 24 hours, she is having severe pain, condition is very bad, that kind of very bad situation where the baby may be dead, the fetus. Now if the surgeon has to intervene, that is a very high risk operation. The risk to the mother, risk to the baby may be already dead. So this kind of very high risk to the patient, when you are going to do operation on that, then you have to get special permission from the king or a king's officer. Now these are very much emphasized wherever major high risk operations are done, how to do that, how to get this permission. So all these details are given in the Sushruta Samhita. And similarly, before the operation a patient has to be prepared. You cannot, unless it is an emergency, which is also, Sushruta says that if it is an emergency it is like firefighting, you cannot have any prior preparation, you have to rush and put out the fire. But other than that, all the elective operations that you do, most of the operations done are elective operations. A date is fixed, come tomorrow, day after, etc. During that time, a good deal of preparation is necessary about the diet of the patient, the drugs, suppose he is a diabetic, about the drugs that he should be taking, the conduct, exercise, he should not be doing violent exercise and come straight to the operating room. So that conduct, then local care, suppose the place where you are going to operate, there is a fracture for example, that local care, any special cleaning required, shaving, whatever else. So that local care, dressing, bandages, all these things are important before operation, before you do it, and similarly after operation, the care of the wound, general care. How do you suppose he is not able to eat after an operation? How do you feed him? He has to have nutrition. There must be some way, special diet for him, etc. So all these pre and post operative care, what Sushruta calls Purva Karma. Purva Karma is the operation. Purva Karma is the preparatory steps before that. Similarly, after the karma, Paschat Karma, what we call post operative care, these are described in regard to all operations. Then the question of preparing the operating room, how did they do this operation? So in those days, hospital, that term was never used, but it is very clear from the descriptions that they had to have a residential facility to do this, a special room, a spacious room which he talks about, how that room should be prepared. And now there you will find nothing was known about microorganisms or infection or anything, but they prepared the room by fumigation, assembly of all the instruments, presence of attendants, etc. It is clear there was a residential facility, what we call nowadays a hospital, and there is no mention of anesthesia. How did they do these operations without anesthesia? This is a major question. And in this context, we must remember in the Western tradition also, until the 19th century, there was no anesthesia. So the method everywhere was, including India, was to give wine in large doses, which dulls the pain sensation. It is not an anesthetic, patient is conscious, but the pain sensation is dulled. That is all it does. But still, if you use a knife and cut, it hurts. So therefore, you have to have physical restraint. These are the two methods used in Europe also up to the 19th century. Nitrous oxide, which was a great discovery in chemistry, only with that anesthesia came into the operating room. Until then, it used to be same as we had here, give lots of wine and control the patient. In fact, in London, if you go and see the museums of some of the great hospitals there, where operations were done in the 18th or early 19th century, like John Hunter's time, there you will see a special instrument, big knives being kept there. These were used by surgeons, because one of the commonest operations in those days was amputation of limbs. Because of infection, there was no treatment, so they had to amputate legs usually. Now to do the amputation is a very major procedure. You have to cut the bone, you have to cut the muscle, the skin. Now the method done was to heavily give wine, big doses to the patient, and the patient would be held physically, and the surgeon had to be extraordinarily quick in his procedure. There was no place for a slow surgeon. So these big knives which you see there, which we will find it difficult to use today, with that knife he would just within 2 minutes he would cut off the leg. That was the procedure used in those days. So that in India, Sushruta's time, more or less things were in that shape. There was no anesthesia. So patients were given wine to produce analgesia or dull pain sensation, and strong attendants holding the patient in the position, desired position that the surgeon wanted. For example, an operation like removing a stone from the urinary bladder, the operation is done from the perineum. It is extremely painful. One is even wondering how this could be done. Today when you read it, you are amazed that such a procedure could be done, because it couldn't be done in 2 minutes, it takes time. So sometimes during the procedure the patient would die. So therefore he had to take special permission from the king. All these are described. So therefore without anesthesia, that was a severe limitation on the operations done in those days. Now basic surgical procedures I mentioned, all big operations, whether it is amputation, whether it is removing the bladder stone from the perineum. These are major operations, but they all consist of many smaller procedures, units of surgical, and these are those units which are listed here. One is the excision, you are cutting off something, chedya, that is one. A tumor or a swelling or something, that is excision, cutting it off. Second is incision, you make an opening, suppose there is an abscess, you do not have to cut it off, but you have to open so that pus can come out, that is an incision, that is called bhedya. Scraping, if there are warts or small skin lesions you want to scrape it off, that is a surgical procedure, that is lekia. Puncture, suppose there is a collection of blood or pus or something in a body chamber, you want to put a needle and puncture that. Nowadays we do it to get a sample of that, that is a procedure which is vedhya, karna vedhya, piercing the ear, which is done even in India today. That was a very common, the commonest puncture was that. Asia, probing, suppose somebody has foreign body has got very commonly described in Sushruta Samhita. It was very common for animals to attack somebody, or an arrowhead, somebody shot an arrow and an arrowhead was stuck inside and there is a track, it has gone through the skin, or somebody who has got an anal fistula which may have a very tortuous track. If you wanted to trace that, internal opening is one place, external is somewhere else, and if you want to probe it, that probing Asia, that is another procedure in surgery. Then there is extraction, suppose there is a foreign body already gone and broken off, a splinter sitting inside. If you want to probe it, that is another, probe it and take it out, that is extraction of that foreign body, that is aharya. Then drainage, if there is a lot of collection of blood or pus or anything you want to drain it, that is visravya, that is another procedure. And lastly, if you have cut or a surgical operation, you have made an incision, or animal has attacked a fresh clean wound, you want to suture it, that is another sevia. So these are the different type of units of surgical procedures, and in one major operation you may do many of these, it is not just one. Like for example, if you make an incision surgical, you have to use a suture it, sevia is necessary. So these are different procedures, small units of procedure which have to be combined to do a major operation. Now these, how do you teach the trainee when he comes, before he actually operates? He has to learn these basic techniques, and here one of the outstanding achievements of ancient surgery in India was using models to train young surgeons. So what we would, it is something like one of the earliest examples of simulation used in teaching. Now that is quite ingenious. Now here for example, these are all described by Sushruta. Now here is excision, the knife, how he should handle that knife. This is usually taught in a fruit, how do you cut off a piece of that. When you make that incision, it has got internal various contents inside that fruit attached to that, you have to cut off all those. So excising a piece of that, including the outer shell, how do you do that? How do you handle the knife? How do you handle that piece to be cut out with a forceps? All these, that excision procedure is taught in a model like this. Similarly, another example, incision. If you want to make an incision, how do you make it? How do you let out the contents come out? That is in the, and these are all taught in a leather bag is used for making an incision, and a fruit is used for excision. Now then scraping, this is used on a piece of hide, and the instrument also is different. You simply on the surface only you do it, you do not go too deep so that you do not have blood coming out, that has to be done carefully, gently. And similarly the puncture, vedhya, and that is in a lotus stalk with a fine needle. How do you insert it? How do you, there are channels inside the lotus stalk, how do you get into that and no further? Now that kind of fine precision movement, doing a puncture, that is taught in a lotus stalk. And then we come to probing, and here is an old moth-eaten trunk of an old tree, and here is one of the instruments called eshani, which you will see later on in the afternoon, and now that is used skillfully to track how this track is going, in what direction it is going, that is taught in this model. And then Aharya is a jackfruit, and the jackfruit has inside nuts in that, and how do you probe it and how do you get it out. That is again a special instrument is used to extract it, that is taught here, another technique. And then here is the two pieces of thick cloth or hide, it is used how to stitch. There are needles, special types of needles, different types of stitching, but these are all taught in these models. So the a student, a disciple undergoing training, doing this in these models repeatedly, he gets the familiarity with the instruments, how to handle them. He develops a skilled hand slowly, he develops confidence, he develops speed in doing this, so that by the time he gets to doing this on patients or assisting his master, his teacher, he is sufficiently skilled. So the use of models in practical training, this is more than 2000 years ago, that is something of a very great achievement, how this was done in those days. Now then the question of getting the operating room ready, if an operation is decided. Now look at the kind of preparations that they had to have. Blunt instruments, we will have the whole discussion this afternoon will be on instruments. There are two classes of instruments, a large number of blunt instruments, 100 blunt instruments were described, and there were 20 sharp instruments, yantras and shastras. Now they all had to be in position in the operating room. Caustic alkali has to be there, Kshara, Cautery has to be available, an iron rod should be available, surgical horn, leeches, these are used for bloodletting, gourd again used for bloodletting, jambu vashtam, it is again something like a probe. Now these all should be available in the operating room, and also other items like these, not instruments, like cotton, cloth, thread, leaves, leaves are often used as a dressing, bandage, a bamboo fan to keep away flies and so on, a frying pan, honey, ghee, mussel fat, milk, oil, medicinal decoctions, various kinds, ointment, paste, hot and cold water, strong and fearless assistance. All these should be available in the operating room, ready to use. And it was the duty of the attendant to make sure that all these were available before the procedure was started. Now the patient is kept fasting, that importance was recognized for any major procedure, overnight fasting, that was considered necessary, like urinary calculi, malpresentation of fetus, all these are major procedures. Any such major operation to be done, patient had to be fasting overnight. That is something which we do even today. The reason being, suppose he had a meal 3 hours earlier, or he had been drinking something, then what happens is not all of it would have gone away from the stomach. So when you are giving him a lot of wine, he is kind of dazed, it is quite possible with the first incision he may throw up, and if he throws up, he is not fully conscious, so it may go into his windpipe. It may produce respiratory problems, what we call aspiration nowadays, that is a great danger, greatly feared. So therefore a patient should be fasting overnight, that is a standard rule now, but that was observed even at that time. And the day of the operation, except emergencies where none of these can be considered, they are fixed, they always consulted the astral position, the stars, that was consulted even in those days. All elective major operations, there was an element of danger, a risk to life, so it was believed that an auspicious time should be fixed for operation. And it is interesting that this ancient belief in India even today, nowadays patients do not often say that, but once in a while you will see patients requesting the surgeon, sir, I understand you have to fix it, but if possible you please fix it on this, because of their belief in this. So this is something ingrained in India, but at that time it was observed. And the room had to be a large room, clean, so that all these are no cluttering in the room, all these are arranged which we have seen, free from wind and dust, fumigated earlier. So this was the way antisepsis was ensured in those far off days. Nothing was known about microbes, but Gugulu, Aguru, Sarjarasa, Nimba, these are all commonly used medicinal plants now, but they were used to create smoke, and that fume was filling this chamber for some time, and that was the way the antisepsis was ensured in these operating rooms. Now the basic procedures which we saw earlier, there are some surgical operations as examples which we are giving here. Excision, for example, the first one which you saw, that is used in anal fistula, a common operation in those days, and anal fistula, if there is a tract, that whole thing is excised. It is located, its direction, its shape, etc., and once that is determined, it would be excised, cut out. Black mole, piles, these are all examples where that particular lesion, what we call a disease, the diseased part, that is excised, it is completely removed. That was an example of excision being used. Now incision, carbuncle. Carbuncle is a big abscess, especially in diabetics, very common in those days. Now there incision is used to drain the abscess. Another is dental abscess, soft glandular swellings, something like ganglion, not pus. These are soft glandular swellings. For draining all these, you would make an incision. And scraping is vitiligo, that was done. Even now you see these white patches on the skin, ulcer tracts, superficial, scars, all these you can scrape off so that you reduce that disfigurement. And puncture is removing fluids from the abdomen, scrotum, body channels, and so on with a needle. And probing, as I mentioned, sinus tracts is most common to trace the cause, to the presence of foreign bodies, etc. You can use probes. There are very many different types of probes, curved, straight, different types of tips. So the probes of many different kinds, shalakas, they are used to locate foreign bodies or direction of the sinus tract and so on. So that was the use of probing. And then we have extraction, gravel from the urinary tract. Before big stones form, there is an earlier stage when smaller stones, gravel, will be passing. Now if there is a collection somewhere, you can use this instrument to scrape it off so that they don't keep on growing and becoming a big stone. Tartar of the teeth, there is a special instrument for that, how to scrape off the tartar from the teeth. Danta shanku, there is an instrument to remove earwax. So they are all extraction from within the body. Then the drainage, a localized abscess, inflamed earlobe, cystic swellings, and also the hydrocele, a very, very common condition, drainage, again the same procedure is used, or fluid collection in the abdomen for ascites or what is called dropsy, again this procedure of drainage, evacuation, that is used. And suturing is repair of wounds caused by surgical incision, it has to be repaired, and similarly fresh, clean wounds. If it is an accident, you have to be sure that it is very clean. If there is a lot of dust or dirt in that, you will not suture it, you would leave it open. Open treatment was recommended, which is even now correct, because you do not want to close it if there is a lot of foreign material stuck there which you cannot remove. Otherwise repair is done, that is suturing is used. So these are examples of all these procedures, 8 of them that we have mentioned, all of them being used in specific operations. Now suturing, again you will find very fine details are given, different types of needles are there, semicircular needles, 2 finger breadths long, even dimension is given, 3-edged, 3-finger straight needles are given, semicircular round bodied needles are given. So different types of needles which even now we need straight needles, we need curved needles, semi-curved needles. The needle will have to be a kind of a 3-edged so that it is very sharp, you can pass it very quickly. There is a tough fascia if you want to, you do not want a round bodied needle there, you want the 3-edged sharp needle. So all these different types of needles were used for scanty muscle. Suppose a man is wasted, he has no subcutaneous tissue, there the approach would be different from a man with a lot of subcutaneous tissue, so the needles used would be different. So you can see the details are given how to use different types of needles in different situations. Now then we come to, after the operation is over, you have to have bandages applied. Now that is a skill in itself. You have to have, like for example, an amputated limb. How do you cover it? A special type of bandage. How do you tie that? It sounds simple, but it is not very simple. It requires special skill. Or for example, suppose there is a surgery is done for the old surgical operation of repairing the nose. Nose operation is done. How do you bandage that? Something on top of the skull. How do you bandage that? Something on the shoulder or rib fracture. How do you put a bandage around? These are special locations. Special situation is there because the rib is constantly moving. You cannot stop it. So how do you apply a bandage? So that is a science in itself, and there are so many 14 different types of bandages are described. And you can see that material used for this, cloth was made from linseed fiber, cotton, sheep's wool. All these were used in making bandages, because in a very cold place where Ayurvedic texts were written in the Himalayan country during the winter, the bandage you may not want to use cotton because it has to be warm, so you may use sheep's wool. So different types of material were used to make these bandages, and the inner layer of bark of trees were used, and animal skin were used. All these were the different types of materials used in making bandages, and these are essential to keep the wound clean and to give some rest, local rest, which will promote the healing, and also especially over the joints it will support the joint, otherwise joint will keep on moving and delay the healing. So therefore multiple purposes were served by these bandages, and these 14 different types. Disease part was covered with cotton, the physician holding the rolled bandage in the left hand, and he will be using that. So something like essentially what we are doing, that in great detail it is given. Now these are the examples. There is a amputated limb called sheath or kosha bandage, that is one type for the amputated limb. Then if it is the middle of the leg, it is simply a long roll, dama, that is another type of bandage, fairly simple to apply. And then here it is cross like. Suppose somebody has an injury on the hand, how do you bandage that? That is a special cross like bandage applicable to the hand. And here is a katua applied to the head and neck. These are very difficult areas to bandage. So this is something for injuries, surgery, etc. above the clavicle level, head and neck. There are different types of bandages. This is a katua, a four-tailed bandage applied for head and neck injuries or post surgery. Now then here is a circular vibhantha for chest. If there is a chest injury or a wound inflicted on the chest and you have dealt with it, you have wanted to cover it with a bandage, that is a special type of bandage, and the material should be such it will not obstruct the patient's breathing. Now here is canopy on the top of the head if there is surgery or if there is a wound of some kind, and that has to be dressed. Now here vidhana, that is another type of bandage. Now here is a string bandage, goshpana, which you will find often being mentioned for the nasal repair, and similar procedures which were done in those days. And there a special type, you see how complicated that bandage is for goshpana, which is several times I see it being mentioned, string bandage, and five-tail bandage, panchanga. So there are different types of bandages for different type of locations and different types of indications. Now dangers and complications in performing surgical operations. One of the problems is incision. You make too small an incision or too large an incision. These are very serious dangers which a surgeon should desist from, and the surgeon injuring his hands because there is great pressure for him to do a quick procedure because anesthesia is not there, and in that case he might cut himself. So that is another danger. Then these and similar dangers are caused largely by inexperience, ignorance, clumsiness and so on, lack of proper assistance. All these could produce, but that is very dangerous for the patient. So injuries to vital spots, so we had a long discussion earlier on marmas, and marmas are called vital spots, recognized even from Vedic times. Now these marmas may be it is a confluence of different types of muscles and tendons and blood vessels. They are all joining together in a particular spot. That is a marma, which from experience they had seen a damage there can be fatal, or it can immediate fatality or delayed fatality, delayed complications, deformity. All these things could occur because of this particular crucial nature of that spot, vital spot. Now the importance of this vital spot was precisely this: a surgeon, to locate an incision, he should be very conscious of these vital spots and to stay away from them in siting his incisions. So because of the grave nature of injuries to the vital spot, a surgeon should avoid these vital spots in making his incision, otherwise there will be a serious complication. Signs of injuries to blood vessels can be immediate danger, could have severe bleeding for example, or it could be a delayed, suppose you have cut a nerve or compressed it or done some damage, you may find a few days later that part is paralyzed or the sensations are gone, that kind of problem. So all these should be avoided by siting the incisions properly. And then so a Sushruta quote there, a fraudulent physician, a quack, whose work is murderous, these are his Sushrutas, and who injures himself during surgery should be avoided by all who desire to live. So these are careless surgeons, or suppose he is not sure of something, he does it and he knows he has made a mistake. In all that confusion and the fear that the king might punish him, that is the kind of thing which he might panic and he might hurt himself. So all these are the lack of experience, ignorance of anatomy and so on. So if there is a person, a surgeon like that, one should stay away from him. This is what Sushruta says. Now then we come to the use of caustics. Many conditions can be treated by the surgeon without actual operation by using caustics, chara. That is a very important part of surgical treatment, and these caustic alkalis were very widely used, and many of these excision, cutting off, scraping etc. could be avoided by using this procedure of chara. That was the importance, and it also helps, apart from cutting it off, the perturbed doshas, because after all surgical disease does not mean the whole body is not affected. There is nothing purely local, there is a general disturbance of dosha, and you might consider a surgical condition a localized manifestation of a general disturbance of doshas. So these charas also have a property of neutralizing the perturbed doshas. That is an advantage, and it can be used purely topically. Largely it is used topically, but also there are indications where you can use it internally in treating conditions like gulma. And topical use is the most common. It is used in vitiligo, in treating piles, vitiated ulcers, warts and so on. Vitiated ulcers, from the description it looks very much like infected chronic ulcers. In treating that again these charas have a place. And ingestion, taking it orally, it was much less used, but it is used in treating poisoning or gaseous lumps of the abdomen, indigestion and so on. Now the preparation of the caustic alkali, it is a long description in Sushruta, how the mushkaka tree, you go to a hill where this tree grows at a particular auspicious moment, you have to say your prayers, how it should be cut, how it should be burnt, how it should be prepared, the whole series of steps, and finally you have three types of chara preparations are made: the strong, the medium, the light. All these are described in great detail how to prepare it. And if the paste is prepared, is free from or it has the right strength, it is the medium or mild or strong, if that kind of paste is made, it is smooth, it is viscid, it does not flow freely, it is a viscid, a pasty kind of thing, comforting and quick acting. These are the signs of a good preparation of a chara, and the patient is prepared exactly as for a surgical procedure. The same has to be fasting, all those, auspicious time is chosen and the diseased area is cleaned, scraped gently, and the caustic is spread and kept thereon for 100 matras. A matra is the time taken to pronounce a short syllable, that is the matra. For 100 matras this is kept in contact, and then it has to be washed off by an acidic substance like vinegar or plain water. It is washed off so that it does not produce a burn. And again the indications and contraindications, when it can be used, on which type of patient it can be used, when it should not be used, etc. All these are a long list given for the guidance of the surgeon. Now other procedure, caustics, if that is not sufficient, you want to use something stronger, that is Agni Karma or use of Cautery. Now these both the caustics as well as Cautery, these were used in Buddha's time also, even earlier. So these are very old procedures which you find in Sushruta Samhita, and these are ranked above caustics in seriousness and successful in treating conditions resistant to drugs. Suppose you have a chronic ulcer, you have tried caustics or you have tried various medications and there is no response, and you are likely to use Agni Karma and produce good results. And now whether there was a difference of opinion, Sushruta himself says that for skin and subcutaneous tissue, if there are ulcers etc. conditions, the cauterization can be used, but it should not be used, the Agni Karma, for deeper lesions. Suppose there are blood vessels there or tendons, but Sushruta's own description is, yes, it can be used. There is one school where it should be used only for the skin and subcutaneous tissue. Any deeper tissues involved, you should not use Cautery, but that is not a view accepted by Sushruta. He is in favor of using it provided you are very sure of what you are dealing with. In that case he is in favor of using it. He even says in one place, if the deeper lesion you are treating, suppose there is a blood vessel, when you apply Cautery, the blood vessel, the blood will clot, that is what he says. So he was fully aware of the danger. If you are cutting a blood vessel out, you will expect it to bleed, but if you are applying this in the proper manner, because of the heat there will be a thermal coagulation, so bleeding will not take place. And in many of these you will find Sushruta was a radical. For example, in fractures there is a place, normally you fracture, you set it, but suppose a patient comes to you who had been treated elsewhere or not treated, and he comes with a deformed union. The bone has united, but there is a deformity. How do you deal with that? And there you may either say leave him alone, that is one policy, but Sushruta says it is possible you should break it and reset it. So you will find a certain touch of radicality in his approach, like here even in deeper lesions you can use this Agni Karma, that is what he says. And the main considerations are, again, you should look at the vital spots, you should stay away, you should have a thorough knowledge of these 107 vital spots, where they are, and you should stay away from them. You should look at the strength of the patient. If you are going to apply this, for example, a deeper lesion, you want to apply a Cautery, patient has to be very strong, mind and body. So those things you must be aware. Nature of the disease and the season. If like in the month of May temperature is 43 degrees in Delhi, that is not the time when you would do this kind of procedure with no air conditioning, etc. So time is very important. Now the Cautery was generally applied over the disease spot. Suppose it is on the forehead, then the eye should be protected. If it is the lower abdomen, the genitalia should be protected. These are all very carefully mentioned, how to protect those when you are applying Agni Karma. Now again you will find as usual a large number, a table virtually, of where it can be used, where it should be used, where it should not be used, contraindications and indications. You will find a long list for all these. And the Cautery which is applied, that instrument can be of many different, depending on the kind of disease that you are treating, the localization of that disease. It may be shaped as a ring, or it may be a single point, or it may be multiple lines, or it may be a full scale contact, almost like a plate. So these are, you have to be chosen the end point, the business point of that Cautery, what particular shape that you want to use, that depends on the lesion that you are treating. So that is mentioned. and then when you apply that, when should you stop? That again, the end point of application on skin, muscle, blood vessels, etc., they are clearly mentioned, that blood would clot during the application, the white color appears, all these, when this happens you should stop. So those endpoints are very clearly described in the Agni Karma. Now then we come to bloodletting, which is half of surgical practice according to Sushruta. It was so extensively used for a whole variety of conditions, and bloodletting incidentally was a universal practice, whether it is Greek medicine, Arab medicine, everywhere bloodletting was extensively used. You often see it being mentioned, and in the medical treatment of diseases in Ayurveda, you will find the most important procedure in evacuation is enemas, use of enemas. Very large number of Charaka, for example, a whole sthana is devoted to enemas. It was so very important. Now according to Sushruta Samhita, bloodletting has almost a similar kind of role in surgery, the number of indications for the use of bloodletting. And in the modern medicine also it was used even in the early 20th century for specific conditions. If there is a whole lot of blood collected in congestive heart failure, etc., or children with cyanotic heart disease, blue babies, there are conditions where bloodletting was used even in modern medicine, even in the early 20th century. So in Ayurveda it is most beneficial in treating inflammatory diseases of recent onset, that is one, chronic ulcers following snake bites, but it is forbidden in generalized swelling, pallor, abdominal swelling, tuberculosis, piles, etc. So these are some I have taken from the long list of indications and contraindications. And there are two methods commonly used. One is scarification, the other is venesection. We will deal with that. And scarification involves fine straight scratches on the skin by a sharp instrument, whereas venesection you are actually drawing blood out of a vein. So these are the two, scarification and venesection, and venesection is done through different techniques. Now bloodletting by venesection, suitable in all patients who need bloodletting, contraindications are listed where it should not be done. And patients prepared by lubricant therapy and fermentation. So this, as you know, there are preparatory steps used in all kinds of panchakarma, whether it is emesis, whether it is purgation, whether it is enema, all these, or nasya, any of these procedures you have to have these preliminaries, that is you have to have lubricant therapy, a course of fatty substances being taken by mouth as prescribed by the physician. Then he has to have a whole body fermentation, that again is another procedure, and all the rationale for doing this we have discussed already. Only after that bloodletting can be done. It is not like any patient, just straight outpatient you do a bloodletting, or outpatient you take somebody, or a tourist center, somebody coming, you give panchakarma, you give emesis. It is not just giving an emetic and making him vomit. There is a preparatory steps, and these are lubricant therapy and fermentation. They are required before venesection is done, and he has to be on a nutritious diet, and patient usually is in the sitting position. This is, I will give a diagram to show that, and the vein has to be made prominent. Here he is talking about the external jugular vein, which you can see in many people, thin people you can see them. That vein is often used for head and neck venesection, head and neck conditions. Now there the patient is sitting up, that is a very favorite position for bloodletting, and there a small cut is made and the bleeding is done. And head, leg, hand, hip, shoulder, abdomen, chest, all these are described. If you want to do venesection for a lesion in the chest, where should you make that incision? Where should you do it? All these are described, tongue, penis, every location where venesection should be done, these are described in detail, and a small skin incision is made, and that instrument to make that incision you will see it in the afternoon, and then the bloodletting is done. Now this is the position in which the bloodletting is done, or phlebotomy in the neck. So an attendant is holding him from behind, and the neck incision is made, and bloodletting from the external jugular vein. Now formulations in this procedure, formulations to be applied to stop or enhance the bleeding. Suppose you make the incision and the blood is not coming, or it's coming too little. There you have applications and warmth applied so that it opens up and bleeding is enhanced. How to promote that bleeding? And suppose the bleeding continues, how to stop it? There are various substances mentioned you can apply and reduce or stop the bleeding. That is also mentioned. And the upper limit for the bleeding, surprisingly, is 648 ml. Now we generally don't bleed more than 500. So they were quite radical at that time. Whether it is 648, this kind of calculations, I am not sure myself. I have asked my colleagues who are expert Ayurvedic people. They have estimated and told me it is 648. Now that is a bit high. Nowadays we don't usually take more than 500 ml or 550. So this is, but anyway, it is more or less in that range. And a large number of diseases are treated by bloodletting. They include cellulitis, I have just given common examples, glandular enlargement, sciatica, goiter. They are all completely unrelated, like sciatica or goiter, splenic enlargement. So these are all very diverse conditions affecting different systems, so that these are examples. And the respective sites for doing venesection are also indicated for each of these. And there are 20 types of faulty techniques and number of different complications which can follow, including air embolism. That is also mentioned. If you are mentioning, suppose, external jugular or veins like that, if you open it and air can get sucked in. So air embolism is also mentioned as one of the complications. And after this is done, the aftercare was very elaborate, included lubricant therapy and fermentation again, non-exposure to extreme weather, rest, nutritious diet. So there is a certain management almost like surgery, patients management following venesection. Now these are, scarification is used for minor skin lesions, but something more than that, skin lesions, if you want bleeding, this is horn, a shringa is used, or it is a gourd, alabu. And when you apply this over a small incision, it is a mild suction being applied, small type of. So scarification is used when the disease is strictly local, it is minor. And horn and gourd are used for skin lesions where there is a gentle suction, a certain amount of more bleeding is promoted by the use of these. But if anything more than this required, for whole body is affected, then you need venesection, which we have seen, or the use of leeches. Now leeches were highly favored because like for example children or the king, you have to treat the king, and generally nobody would like to make an incision. So leeches were preferred. This was the most gentle way of treating. In fact, leech was a term used for physicians. In fact, in Atharva Veda there is a hymn, a famous hymn which says, I am a poet, my father was a leech. Now what it means is the leech, his father was a physician. So leech is a synonym for physicians. It was so commonly used. And phlebotomy was used in the treatment of heart failure and conditions like polycythemia in the 20th century, which I referred to. I have not seen it done, but I know that in early 1920s, for example, in blue babies, where their red cell content goes up very high. That is, what happens in these children, as you know, the blood does not go into the lung, it cannot go because of a block in the heart. So blood does not get oxygenated, so they are severely cyanotic. Now in an attempt to carry more oxygen, the body keeps on generating more and more red cells. So they have very high, in our blood for example, the red cell percentage of blood may be 45%. That is a healthy range. But if it becomes 65%, that is what happens in these children. So the blood will clot. It is so high, so dense. So the only attempt in those days, there was no open heart surgery to correct this. So they would remove blood. So that was the kind of use in 20th century. So it is not a discarded procedure. And leeches, this is the gentlest and the best method. And there is a very detailed description, the type of leeches, how to collect them, all these are given. And the cow's horn was advised, you have seen the picture of bloodletting in Vataja disorders, and 12 types of leeches are described, 6 venomous and the rest non-venomous. not all of these can be identified today, which Sushruta had described. Now, catching and rearing of leeches, where do you get them from? What does a healthy leech look like? All these are, a physician has to be aware. And readying the site for applying the leeches, how to make it attractive for the leeches, technique of applying a leech for detecting whether it is sucking blood, methods to enhance the grip of the leech and how to release it when it has been full, how to release it, and disgorging the blood from it after it has been removed. All these are very interesting to read, that how these techniques were used. Obviously, if you read the description, it makes it very clear that whoever wrote it had very great experience in doing this. The minutest details are given. And similarly, once a post-vivisection, just like phlebotomy, there is a post-operative management about local care as well as general care. Now, surgical options. Now, this is the point, I think I will stop with this, that here is important. When you see a patient or a family, they come to you not for a surgical operation. The last thing they want is an operation. They want to avoid it. So, how do you make a decision when to apply surgery? Now, here this is what is meant by surgical option. A surgeon has to choose the appropriate procedure for each patient on the basis of his disease, injury, strength and season. So, these are Sushruta's general guidelines about deciding on surgical course for a patient. And in the case of injuries caused by accidents or attacks by wild animals, very common in those days, one would do immediate cleansing and repair by one of those techniques which we have seen earlier, basic techniques. And in chronic ulcers and other conditions, these are elective conditions, surgical procedure would be preceded by dosha neutralizing treatment. Now, here this is the point I made in the beginning. A surgeon is not just an operator. He is a physician with a special skill, so that this dosha neutralizing, suppose he has a chronic ulcer and he has got a generalized dosha perturbation. So, that may be the reason why that ulcer is not healing. Now, if that is the case, a physician, a surgeon who does not know anything about dosha neutralization, that general condition underlying this local problem, then he is unable to treat. So, this is the point which Sushruta makes. So, in treating that, a patient like that, it is the surgical intervention is one small episode in a general management of the patient. So, he has to be fully aware of the physiology of the disease process and so on, if he wants to be successful in treating. So, that dosha neutralizing treatment, preparing the patient, like nowadays we will say a diabetic, for example. A diabetic has a non-healing ulcer, and managing it like cautery and so on without knowing the underlying diabetic condition, you cannot succeed at all. You will make him worse. So, therefore, this is the point which he makes. If it is an urgent patient who has been attacked by an animal, laceration is there, he comes to the outpatient department, you have to do something, emergency, he is bleeding, you have to do something. That is one aspect of surgery. But a great many conditions are not like that. These are chronic, they come, they have had it for several weeks or months and they approach the surgeon. So, he has to be a good physician. That is why Sushruta Samhita, it is not a surgical text, there is a great deal of surgery in it. There is a surgical orientation to whatever he says about drugs, etc. You will find that surgical orientation. There is a special section on locally applied medications, which is not there in Vagpada or in Charaka, for the simple reason local treatment of with medications is important in surgery. So, there is a separate section in Sushruta Samhita. So, you will find that surgical orientation throughout, but there is a great deal of authentic, genuine internal medicine there. Classification of drugs which we use as an authority, because a good physician with a special surgical skill, that is Sushruta's definition of a surgeon. Now, only when all the other measures, suppose surgery is necessary, if you can treat it with caustic, for example, you have a chronic ulcer, before you do excision and procedures like that, can you treat it with caustics? Or you have piles, is it a variety which can be treated with the caustics? If it can be, then you would try that. If that does not work, can you try with Agnikarma? A cautery can be used. If cautery will work, you would prefer to use that. These are lesser procedures. or can you do in certain situations, can you treat it with bloodletting, phlebotomy? In that case you would prefer that. So only when all these are not applicable or they are not likely to give good results, only then you would opt for surgery or operation. So that was clearly, it does not say, even though we started in the beginning saying that Shalya is the noblest, it is the best form of treatment, etc. You are extolling surgery in the beginning, but there is very clear recognition from the patient's point of view that should be the last resort. If you can treat well with the other techniques, lesser techniques, you would prefer those, and in the absence or not possibility of doing those, then you would not hesitate to use surgery at the right time, not to delay that. This is the scope of this lecture, a general introduction to surgery, and we will be talking about surgical instruments, because none of these procedures that we talked about introductory, all those basic procedures, everything requires the use of instruments. That is very crucial, and that is a great achievement of Ayurveda in so many thousands of years ago, such a large number of instruments, very precise. We will have a detailed discussion of that.